So here are some of the basics we want to do for your knee. The first thing we want to focus on is range of motion. I'm going to demonstrate this on a variety of sides, so just obviously use the affected side with this. So the first thing we want to do is get more bend in the knee. So here, when we tried this before, you had difficulty grabbing this, and we're not doing it in a standing position. We're going to do it with you lying down. So with this, if you can't grab it, you can put something around it like this, so you can hold back with this. When you're doing this, you don't want your knee forward, you want your knee back, and essentially I am pulling this to try to bend my knee as much as possible. With any of these exercises, if they're painful, just be real cautious with that, back off. If you have increased pain and it lasts, particularly for longer than 24 hours, you're doing it too hard, or you're doing the wrong exercise. So always use good judgment with that. This is a side lying position, working on my left knee, but you could also do it in a position like this if you feel more comfortable, where you're grabbing, pulling back towards you. You want to hold this for 20 to 30 seconds, relax, and then do it 2 times. If you feel like it's too easy, you can do it multiple times a day with that. Okay, that's the straightness, that's the bend of the knee. If we wanted to work on some straightening of the knee, and this one is really critical. We're going to get a couple things here. So essentially, working on the left knee here, what I can do is I can put a pillow out here so I feel comfortable. I put my leg out there, and I want to put this out to where essentially my heel is on that, and then I can put a towel over this so it's a little more comfortable, and this is a weight. So I can just set a weight on top of that and just let the weight do the work. If it's going to fall off, just put your hand on there to hold it there. And you just sit here. You can sit here to whatever you feel like you can tolerate. 5 minutes is often at a point where you start to feel like, hey, I'm starting to feel a little bit of pain in the back of the knee. You just take these off, and then you just bend it a little bit, put it back out there, put it back on there, and hold it. So if you did this 2 or 3 times a day for 5 minutes, that's really working on your ability to straighten that leg. And then how would you test that? So you could then, when you test it and you sit down, you can just get down in this position, and let's say you've got a little bit of bend in your knee there. You just put your hand underneath there and kind of get a feel for how much space is there. Eventually we're going to want that space to be non-existent, but we want it to be improving. If we're not getting any improvement over time, we're probably not doing an effective exercise with that. So that is trying to bend the knee and straighten the knee to make sure we don't lose any range of motion. Okay, then let's look at some exercises where we're going to do some strengthening. So with the pain that we're having in the knee, it would be hard to really work directly on the knee joint with that. So I think we're going to focus on some things that work around the hip and are going to have some effects on the knee. So we can do simple leg lifts. So if you're here, you bend one knee up and you're just coming up and down like this. Okay, this is a pretty basic exercise. If you're going to do this, you're probably going to have to do a lot of reps. A couple sets of 30 of these a couple times a day. But we talked about doing a front plank as well. Well, the front plank is going to have the similar effect of hitting the muscles on the front side of the hip as well as working the knee. So the plank is going to be a harder exercise than this. So if you're having some pain with planks, then you can just basically do this leg lift. Okay, so in this case we're working the left side. Now if we want to work the inside of this leg, we can bring this leg over, excuse me, and in this case I'm putting my top leg foot in front of the knee. And then I'm just going to lie down here and I'm going to lift the knee up like this. Correction, I'm going to lift the leg up like this. Again, this is one that's going to be higher reps, 2 sets of 30, but you're not necessarily going to start out with that. You can start out with 1 set of 10, see how it feels, and then gradually go up. So that's going inside like that. So we went forward, we went inside, and then we can do this straight back from this position, coming back like this. You can't really get your leg far off the ground, but you want to do reps like that, and then eventually we work to where you're going like this. It'd be great to get those 2 sets of 30, but we're working up to that. And if you see me from the side, what I don't want you to do is lift the leg forward. You want to have this leg so it's almost going behind you and coming up. That works a much more important muscle with that. So doing it there, not here. Back, then up, toes slightly downward, not up, slightly downward with that. Makes it more difficult with that. So now as those get too easy, or you want some variety with that, you can also do the planks that we discussed. Some of these harder than others. But, essentially starting off with your front plank. So you're in this position and you hold this plank. I like 30 seconds. Let's say that gets too easy with that. You just come up and you go single leg. And you work up to where you can do 30 seconds of that. And those are great exercises. I think if you get to 30 seconds of the single leg version, that's pretty impressive. Then the side, we're here. We just do this side plank for 30 seconds. This gets easy. You lift that top leg up. Considerably harder with that. If you can get top leg up for 30 seconds, that would be very, very difficult. That was primarily working the right hip. If I was going to work the left, I would be in this position, coming up to this position. Okay, so now we've talked front and side in terms of the plank. This is a very, very challenging one. You got to be real cautious with this. If this causes any pain, you just want to not do it. So what it is similar position to the side plank, but we're going to bend the bottom leg and we're going to come up, and you can see my bottom knee is not touching the ground. It's off the ground and I'm floating here. Really works the inside, but it can put some stress on the knee. So if it causes problems, particularly on the inside of the knee, you want to be cautious with that. Okay, now we've worked inside, outside, and front. We're going to work the back piece of this. I'm going to move back so you can see my feet. Okay, with my feet in a long position, my knee is pretty straight, and I lift up. This is very hard. If I bring my legs closer, my heels closer to my hips, and come up, it's a little bit more a little less challenging. So you have the ability to move this out, make it much more difficult. In addition to that, you can do a one-leg version of it, which makes it much more challenging as well. So you could go one leg with the leg further out, much more challenging, and working the muscles of my hamstrings, my glutes, and that's really helpful to help control the stability of the knee, as well as do functional activities. If you have better control at the hip, the knee is better controlled just based on those muscles in this region controlling it. Okay, now we want to always do something for balance. A great exercise, I like to call it the four-way hip. I'm going to do this in a standing position, so you're not going to see the top of my body, but essentially what I have is a resistance band, and it is anchored underneath the sofa. I am facing towards the sofa, so what I'm going to do is I'm going to go directly straight back, like this. I like to do 10 repetitions of this, and let's say hypothetically 10 repetitions is gone, and then I'm going to rotate. So now I'm facing the camera, or my right side is facing towards the anchor point. And then I'm going to cross my body doing that. And I'm trying to maintain my balance, not lose my balance. My hands hopefully are not touching anything. And I'm coming across like this and not touching this foot down to catch my balance. I want to keep it in the air for all 10 reps. Then I'm going to rotate, and I'm facing away from the anchor point, and I'm going straight forward with my 10 reps again. 10 reps are done. I'm going to step over the band, and then I'm going to cross over my body, and then go out to the side. So going out to the right side as I do this. So 4 ways, and then I would just switch over and do the same 4 directions, 10 repetitions in those directions with the other leg. You tend to get more exercise on your stance leg. So as I'm standing here with the band around my left leg, and I'm moving like this, the hip's getting a little bit of work on the left side, but really my stance leg in that single leg balance position is working a lot harder. So that's a great hip strengthening exercise, but even better, a great balance exercise. Okay, my last one I like to do is called the lateral resisted walk. So I have a band, it's a circle like that, and what I'm going to do is I'm going to put it around my feet. And then I'm gonna walk to the side. So I'm gonna do this in a variety of angles so you get a good idea. But I've got my knees bent a little bit, and I step out to the side, and then I slowly come in. Step out can be brisk, slowly return. Step out, slowly return. Step out like this, slowly return. And this is a very short distance. I'm going to want you to go about 25 feet. This is nowhere near that. This is 10 feet maybe. So 2.5 times what I'm doing here. And I'm stepping out like that. Now you want to try to keep your toes slightly inward. You don't want to rotate out like that with the toe out. The hip's a lot stronger in that position. So we want the toes slightly inward or straight forward. And when I say the toes, I mean the feet. The feet are straight forward. Essentially the toes are doing the same thing with this step. Just like that. Back and forth like that. So down and back, 25 feet if you've got it, but eventually working up to where you're doing 100 feet of that. So if I'm doing a 10-foot length down and back, I want to do that 10 times. But you work up to that because that can be pretty challenging. So again, kind of a small loop like this. In review, we did range of motion with the knee where we tried to straighten it and we tried to bend it. We were trying to do the bending 2 times of 30 seconds, where the hold was 30 seconds, and doing that multiple times a day, 3 times a day. These are just guidelines though. You want to do it so that you listen to your body. So when you're doing these, you don't want to do anything that's causing things to get worse, or eventually if you see it's not real effective, then we want to go ahead and stop doing it anyway. Okay, so then we did straightening of the knee. So you put your heel up on something, a footrest, and then you put some weight on the knee and you just let that go. 5-minute time frames are wonderful if you can tolerate that. And you've got that light weight on top of the leg so that it's forcing that knee out into a straighter position, and you're checking it by sitting down, trying to push your knee to the floor and sliding your hand under there to see what the distance is between the back of your knee and the floor to see if you're making progress. After we did that, then we went to leg lifts. We did those leg lifts forward, we did them to the side, we did them to the inside, and we did them to the back. Working up to where you're doing 2 sets of 30 reps of those is wonderful. Now you can continue to do the leg lifts in those 4 directions, or you can move on and progress to a plank where you're doing a front plank, a side plank, what I called an inside plank, and a back plank. And you can progress those to where you're doing them in a single leg version. I eventually would love to see you get up to the single leg version where you're holding for 30 seconds. And that takes some time to get there with that. And then we did some standing exercises where we did the 4-way hip. Standing with the resistance, we went backwards to the inside, forward to the outside. Those are great to do. 4 directions, 10 reps, both legs, once a day. If you feel like it's easy and you want to do more, you can bump that up to 2 times a day. But really the 4 times 10 once a day in both legs is a challenge with that. Try these. If you notice any swelling, obviously it's great to ice the knee. And we can progress exercises if you get to the point where you feel like these are too easy. Thanks. Good luck. Talk to you later.